Kelly, good morning. Thank you for being with us.
Good morning. How are ya?
Great, thank you. Rob here along with Matt Harvey. Matt is the Jefferson County prosecuting attorney. By the way, Kelly has no jurisdiction during the course of this interview. So you're good.
Or at my household, ever.
Those two places, but that's it. Yeah. Kelly, what are you hearing, if anything, new in regards to the Medicaid situation as it flows to West Virginia?
Well, I think there's a lot happening at the federal level right now. So last night, the U.S. House was expected to vote on a budget resolution where they tried to reach an agreement with the Senate around the framework for budget reconciliation. So that's President Trump's one big, beautiful bill that they're trying to extend 2017's tax cuts and also offset some of those extension costs through potential deep cuts to Medicaid and SNAP. And last night it seems like the vote didn't happen because there is wide disagreement between the House and the Senate as to how deep these cuts should be. And then also, I think, wide disagreement inside each caucus in each chamber as well. So a lot is going to ride on what happens today, but we know that the hardliners are the ones that are holding things up. They want deeper cuts to Medicaid and deeper cuts to SNAP to reduce spending to offset some of those tax cuts. But it is important to say in both versions, the House and the Senate plans, they both actually increase the debt and increase the national deficit.
What is the likelihood of West Virginia experiencing some type of change in Medicaid funding?
Well, I think it's a very deep concern for folks who rely on Medicaid, for hospitals, for residents, because I mean, that's the biggest thing. You know, the House instructions say $880 billion in cuts likely from Medicaid and over $200 billion in cuts for SNAP, which is food assistance. And there was actually a vote in the Senate last week where Senator Capito and Senator Justice had an opportunity to vote on an amendment that was brought by Josh Hawley to cut the Medicaid cuts from the budget resolution to make sure that Medicaid funding would be fully protected. And both West Virginia senators voted against that provision to protect Medicaid. So I think people should be very concerned that cuts to Medicaid are on the table. And I think at the state level, state lawmakers have already made it very clear that, you know, all these Medicaid and SNAP cuts that are being considered would essentially shift costs onto the state budget. So if they lower the federal match, if they, change the way the provider tax is allocated, all the different things they're talking about. In SNAP, they're talking about adding a state match as well. What we're hearing from state lawmakers is we don't have room to pick up any of those costs in our budget. So if the state doesn't pick up the share, there's only about three options, which are fewer people are covered by Medicaid, optional benefits are cut, which are things like prescription drugs and home and community-based services, which you all were just talking about, or provider reimbursements are cut. So these are really bad options, considering that the state's not going to step up and offset any of these cuts that are probably going to be coming from Congress.
There was something in the state legislature, I remember about a week ago we were talking about this, where if the feds cut their Medicaid funding and it had to increase the state's share, the state was going to completely walk away from its responsibility on Medicaid. Did I misread that, Kelly?
No, that's absolutely right. There was legislation considered that said if the match for the expansion population goes down, so that's about 160,000 people, if it goes down by even 1%, from the feds, then we would pull out of the Medicaid expansion altogether. So those 160,000 folks would lose health coverage. Now that bill got tabled. It was not considered. It's dead. In large part because there was a swift and broad response. I think when you're talking about cutting Medicaid, you bring together a lot of unlikely bedfellows, a lot of folks that normally don't agree on this stuff. So there was a really swift public response. But then lawmakers also said they'd had some assurances from Congress that maybe that particular cut wasn't in play. But I think that shows us two things. One, there's going to be broad pushback against Medicaid cuts. And two, the state is very clearly saying, state lawmakers, we can't fill this gap. If the feds cut Medicaid, those are just going to have to be passed along to people because the state is not going to be able to make up the difference.
The number of people in West Virginia on Medicaid, I think I read it was over 500,000. Is that accurate?
Yes, it is. Yeah, in the congressional district, Representative Riley Morris, it's 1 in 4 of his constituents, over 200,000 people just in congressional district 2.
Okay, and The vast majority of people who are on Medicaid, are they working and already have jobs or not?
Well, Medicaid covers a lot of kids, about half of kids. It covers 3/4 of folks in long-term care, nursing care, that sort of thing. It also covers folks with disabilities, some who are on Medicare, some who aren't on Medicare yet. And then this 163,000, this expansion population, those are adults between 19 and 64. A lot of them have young children. About 85, I want to make sure I'm getting this right. The vast majority of folks are either working, caregiving, in school, or, one of those categories. So they're either working or they're laboring in some other way.
And it covers people who are receiving treatment for substance use disorder.
That's exactly right. Medicaid, in my understanding, is the biggest source of medical coverage for substance use treatment. And West Virginia was actually the first in the nation to get a waiver for the Medicaid program to be able to cover that population. And that's one of many ways we've been able to use federal Medicaid dollars to tailor our program to be really specific to the needs of West Virginians.
I asked the question in regards to employment status because I know the legislature had considered some work requirements for those who receive Medicaid. Would that change anything as you see it, Kelly?
I mean, I think that's a possibility at the federal level. That might be one of the changes that's being considered. But we've seen in Arkansas in particular was one state that rolled out Medicaid work requirements. And what we found was that the vast majority of people who lost their health coverage, and it was a significant number of people, were not, they were working or they did meet an exemption. They were caring for a family member, caring for a child in school. But the bureaucratic red tape of having to upload pay stubs, go to the office, call, was really where people got tripped up. And a lot of people lost coverage in Arkansas. It didn't increase workforce participation at all. It just tied up and tripped up a lot of people who should have still qualified for the program. So we have a lot of deep concerns about just the bureaucratic red tape involved in managing a program like that.
And Kelly, maybe these are all nuanced terms or whatever, I don't know, but when somebody goes to their state healthcare exchange, people used to call it Obamacare or whatever, and they get insurance, is that separate from Medicaid insurance?
Yeah, so that's for folks who are at a slightly higher income level. I think we have about 60,000 West Virginians who are covered through the ACA exchange. And we heard, I think, in that state bill discussion that you mentioned last week about potentially unwinding the Medicaid expansion, people could just go to the marketplace. But there's actually help for folks who are on the marketplace that's expiring at the end of this year. So those are the premium assistance that help make those plans affordable. It's unclear if Congress is going to extend those subsidies and that help. And then, there's the other interesting thing is it costs a lot more to subsidize a plan on the marketplace for the federal government than to give somebody Medicaid. It costs about 1.5 times more. So if we're really talking at the federal level that we want to reduce federal spending, if we shift some portion of those 160,000 folks on the expansion onto the exchange, it would actually cost the federal budget a lot more because that's more expensive health coverage.
I understand that there are some proposed changes to SNAP benefits in regards to what you can and can spend SNAP benefits on in regards to food. Has that gotten anywhere?
So I think there was a big event in your neck of the woods a week or two ago that the state is going to submit a waiver to the U.S. Department of Agriculture to allow us to limit our SNAP program. I think they talked about a soda and candy ban, and then they also talked about implementing some work requirements, kind of in the same way that we talked about earlier, that creates a lot of barriers for folks that should be eligible, but doesn't really give them a lot of resources. So I think submitting a waiver takes a while. So I think that'll be a lengthy process. And I don't know if we have time for discussion about our concerns about that. But that, too, is, creates a lot of red tape for folks and a lot more bureaucracy in the end.
Well, it seems like with RFK at the event that it probably has a pretty good chance of getting accepted as a waiver.
Well, weirdly enough, he's the HHS secretary, and that waiver has to go to the U.S. Department of Agriculture. But, yeah, I would think that maybe the whole administration is supportive of something like that.
Yeah, I've got about a minute left, Kelly. That minute is yours if there's anything else you wanted to comment on or bring to people's attention.
Well, I think, this federal discussion that is going to take place over the next couple of weeks is really, really important for West Virginians. Yeah, for folks that know somebody who relies on Medicaid or who rely on a rural hospital, over 20% of rural hospitals and all hospitals in West Virginia revenue comes from Medicaid. So these potential cuts would affect you, even if you don't personally rely on Medicaid. If a rural hospital closes or is able to offer less care or, has to lay off staff. So similar with the cuts to SNAP. SNAP's really important for our food retailers, for our food economy. Folks should stay engaged. Let Representative Riley Moore, who's historically been really good on these issues, know how they feel about it, as well as Senators Capito and Justice.
Thank you, Kelly. And if anybody would like to find out more on the West Virginia Center on Budget and Policy, how do they do that?
We are at wvpolicy.org.
Kelly, thank you. Appreciate you this morning.
Thank you.
Have a great day.